Today about a big overhaul of Medicare funding and how the whole system works. Let's go live to the Health Minister, Mark Butler, who is speaking here in Canberra at the moment.
Pharmaceutical benefit scheme, and you are entitled to access Medicare rebates through Medicare, a proud Labor legacy that for so long, frankly, was fought tooth and nail by the Liberal Party over decades. So we do have a great universal healthcare system, but I've been clear, as much as, frankly, the former government tried to disguise this reality, I've been very clear, as doctors have, that bulk billing has been under huge pressure over recent years, particularly after a 6-year freeze on the Medicare rebate. I mean, that's not rocket science. If your income as a general practice is frozen while your costs are continuing to increase, that does place upward pressure on gap fees. About 2/3 of Australians are still getting bulk billed service, but about 1/3 of Australians are paying gap fees. And that 1/3 of Australians, a group that frankly appears to be growing and growing relatively quickly, are paying higher and higher gap fees because of that financial pressure on general practice, in particular on Medicare generally, but particularly on general practice. And that has been a big focus, obviously, of the discussions of the Strengthening Medicare taskforce. But although I've been clear that Medicare is in, I think, the worst shape it's been in 40 years, it's also true that we have a healthcare system that is the envy of so many countries around the world. You know, we need to strengthen Medicare. We need to modernise primary care in particular to deal with that changed disease profile that's developed over the last 40 years. But I, as an Australian, certainly as Australia's health minister, am very proud of the healthcare system that we have here.
Minister, on out-of-pocket costs, some cancer patients are forced to pay almost $10,000 a month for treatment not covered by the PBS. This comes after years of treatments that are. So these are families that have been going through the process for years, with potentially devastating effects. The health department said, when I asked about this, patients are encouraged to discuss financial situations with their specialists. Is this good enough for struggling families who can't afford Medicare, who can't afford medical costs?
Well, as I've been saying over the course of this press conference, we're very focused on the fact it's not only harder to see not just GPs but specialists as well. We've seen those waiting lists blow out, but we've seen gap fees for specialists climb even faster and higher than gap fees have climbed for GPs. The MBS rebate freeze didn't just impact general practice, it also impacts specialists as well. So there's financial pressure right across the healthcare system, and too many patients are feeling that in their hip pocket. As for medicines, I think your question is partly about medicines. We live in a turbocharged period of discovery, we really do, and new medicines, particularly for diseases like cancer, are coming onto the table on a very regular basis. And our Pharmaceutical Benefits Advisory Committee are working very hard to try and get them into our system as quickly as they possibly can. Now, our system, whether it's medicines or therapeutic services or a range of other diagnostic services, is a relatively old system. Our assessment and approval processes for new therapeutics, new medicines for cancer, for example, is relatively old, which is why we've kicked off the first review in a generation, frankly, of our health technology assessment processes, because we want to make sure that these new technologies, these new therapies are delivered from the bench top, if you like, from the discovery of this new technology into patients as quickly as possible. And that's a very strong focus we have during this term of Parliament.